Welcome to the Better Place Australia podcast series. The recent statistics on suicide attempts in Australia is staggering, but there is hope for the future. Dr. Rachel Bonici from Better Place Australia joins us to share insights about the Hope Outreach Program. So Rachel, what is the Hope Outreach Program?
Yeah, Chris, so I'll give you a little bit of context of how the service came about. What we know is that about approximately 65,000 Australians per year will attempt suicide, and unfortunately 9 per day will actually succumb to suicide.
Wow.
So I think that equates to something like 3,000 people per year. That's a lot of people.
That's terrible.
I know, yeah. So for those that have attempted, they tend to be at a heightened risk for taking their own life again. So they really are at a crisis period in their life. So in response to this, the federal government funded Beyond Blue, which obviously is a mental health-based organisation, and they developed a non-clinical prevention initiative. So 30 sites were able to deliver the service across the country. And what the service does is that when somebody has attempted suicide, they're usually admitted through ambulance and into the ED. And when they're discharged, they're referred to the service. So as I said before, we know that this is a critical time for the person. They're at a heightened risk. So we are an immediate response and aftercare prevention initiative.
Right. Can you unpack a little bit more about how Better Place Australia is involved in the service?
Yeah. Great question. So what we do is we were commissioned by the PHN to develop the service and deliver the service. So we provided it to individuals who've been referred through our local hospital networks, which is mainly Monash Health. So that was Dandenong Hospitals. And at the forefront of the service, we have our coordinators, there's support coordinators. What happens is that the person is triaged. What we do is provide an eligibility criteria. Then the practitioner will make initial contact within one business day, and obviously the person is referred to participate or accepted as a candidate to participate in the service. And I guess what the beautiful thing about this is that we listen to the needs of the client rather than not having that person-centered approach. And this really does promote self-efficacy and empowerment for the person.
Yeah.
There's a lot of self-stigma attached to suicide too, and it's really difficult to move forward. And we provide pathways and assist people in navigating both their recovery and both how to function back into society. So we don't really know 100% what these people are going through. Suicide is such a nebulous thing. There's so many different psychosocial factors that contribute to it. But what we do know is that these people need ongoing support. And so that's why the practitioner works so closely with them, just to help them integrate back into society, because we know that from the research, that's the best method of recovery.
Yeah. You've done a survey of participants. Can you tell us about that?
Yeah, sure. So we did it was called a functionality and recovery survey. It's a 6-item scale. It's been psychometrically validated by authors called Batteram and colleagues. It actually measures people who've had a lived experience of a suicide attempt. So fundamentally, we asked participants 6 questions, and they're able to choose their answers from a Likert scale. We measured their outcomes at 4 time points, ranging from initial assessment, which we considered to be the first review, a second review, and when they exited the program. So the lowest scores of the survey indicated higher levels of functioning and recovery. So, for example, one of the questions was, I felt that I was unworthy of love.
Wow.
And the lowest score, yeah, I know. And the lower end of that scale is never or rarely. So that's how we were able to measure it. And once we collated the findings, we discovered that all the responses tended to be at the lower end of the scale. Which is a really good thing, because it just demonstrates that after experiencing the service, it led to people's improve functioning and recovery.
So what are the broader implications of the survey?
Yeah, well, the broader implications are quite exciting because it demonstrates that psychosocial models of care are actually quite effective. So at the moment at the Centre for Better Research, we're currently collating evidence-based information to pull together a literature review, which will inform us of, some broader recommendations as well as aligning with some of the findings that we've had from this service, which is really exciting. So, and that's something that we can disseminate across community, some of our own recommendations, and not just from the scale and from the literature review, but actually from a practitioner's perspective as well.
So what is Better Place Australia's next steps then in suicide prevention?
Yeah, so we're actually looking at the nuances of the program. We're sort of deconstructing it, if that makes sense, and trying to figure out how we can be a bit more contextualized for our clients. So we do have a lot of different groups that attend the service, such as culturally and linguistically diverse communities. We have LGBTIQ. We have clients who have had substance abuse issues versus mental health issues. And then you have the complexity of dual diagnosis. So we're trying to maybe journey map those processes and, the journey experience of the clients. So I think that will give us even more of an in-depth understanding of the, the pain points and the different what works best, what doesn't work best in terms of practice for Better Place Australia, and maybe even, our information can be translated to other aftercare services.
Yeah, good one. Rachel, thanks for your time.
Anytime. Thank you, Chris.
That's Dr. Rachel Benici talking about the Hope Outreach Program. Thanks for joining us on this Better Place Australia podcast. For more details about the service, go to the website betterplaceaustralia.com.au.